instructional video. Today we are going to be talking about the ABG Puncture. We're going to show you the steps that you need, as well as showing you all the supplies that you need. And we're also going to show you today how to do an Allen's test. Let's start with the items that you'll need. First off, you'll need an order from your doctor, lidocaine, alcohol swabs, and a needle for the lidocaine. You'll also need your ABG kit. In the next slide, you'll see what comes in the kit. The kit may come with more items than you need, but for our purposes, these are the items that you need from the kit. Now that we've gathered all of our supplies, next we will go through how to do a puncture, and then we'll also show what you should do with your supplies when you are done. First, you need to have a doctor's order before you can perform an ABG. Next, you'll need to perform proper hand hygiene and put on gloves for this procedure. After donning my gloves, you'll see that I am now preparing my supplies and setting it out in front of me. First, I am opening up my ABG kit and putting out the different items that I have showed you before to make sure I have everything in a place that it's easy to grab. As you can see, I'm about to grab the Band-Aid and put it on the back of my hand. I recommend doing this so it is easy to grab when you're done with the puncture. Now, the next item that I grab is my lidocaine needle and my lidocaine. It is important that you take a moment and ask your patient if they have any allergies to lidocaine that they know of, or if they have any allergies in general. This is important because it can cause serious effects. Next, I am performing an Allen's test. First, you need to have the patient close their fist and include both the radial and ulnar artery. Then have the patient open up their hand and release the side that you are not puncturing. If it returns back to normal color, you know there is concurrent blood flow. Next, we'll perform the lidocaine puncture. Right here, I am preparing our lidocaine and getting the needle hooked up. I have a couple pictures coming up to show you how that should be done. After you have your needle set up, take a moment using your two fingers to find the patient's pulse. Sometimes this is difficult, so you must be patient. Once you are confident that you have found the pulse, you will next need to grab your alcohol swab. Please note that you'll need to swab in a circular motion outward, as to not dirty the area that you've already cleaned. Now you are ready to puncture with the lidocaine. Please note you do not puncture directly on the artery, but slightly to the side. And your needle needs to be beveled up as shown in the next video. Okay, so up to the sky type thing. Please also note that you are going in at a 45-degree angle and only slightly underneath the skin. At this point, you'll be injecting just enough to make a little weld. It is kind of hard to see in this video, but you just make a little bubble and then you will slightly massage it in. You will need to allow a few minutes for the lidocaine to take an effect. Now we are going to perform an actual ABG puncture. Again, you want to enter at a 45-degree angle. For this puncture, you want to enter exactly where you feel the pulse. You may need to move your finger a little bit so you do not puncture your finger. Now, if you do not get blood on the first time you poke in, do not be afraid because arteries do move. Please allow yourself to be able to redirect 2 or 3 times before you pull out and grab a different needle. Here, I am doing that. In the next video, I will show you what it looks like if you hit blood on the first try. You'll know you've hit an artery when you note a flash of blood in the needle. Now, you'll need to hold the syringe there steadily to allow the blood to flow through the needle and into the syringe. Do not worry if it does not flow through quickly. You may just need to pull back slightly, as I did in this video, because you may have punctured through the artery. Once you have done that, just let it sit there and fill up. Once it is full, you need to quickly grab your gauze and place it on your needle before pulling out. Then grab your needle and safely close it using the edge of the table. While that is being done, you need to hold pressure on the puncture site to allow for blood to coagulate. Now, this may take some time, especially for those who have coagulation issues. Please note you may have to hold this for an extra 5 to 10 minutes. Then you put the Band-Aid on and you are complete. Immediately after putting on the patient's Band-Aid, you want to take the patient's label and put it on the needle. You need to do this to ensure that this is the patient's blood, and you need this for ABG analysis. Next, you want to take off the needle and put on that little blue cap. You want to remove any air bubbles from the sample. Then you want to put it in your biohazard bag and take it to be immediately analyzed. If you are unable to analyze it right away, you need to put it on ice so it is able to be analyzed later. Now, let's talk about what belongs in the trash versus what belongs in the sharps container. Anything that is considered sharp, such as needles, both your lidocaine needle and your ABG puncture needle, plus the extra needle in your kit, belongs in a sharps container. We also may throw any gauze or anything that is covered in blood into the sharps container. In this video, I had to find a new sharps container because my other one was full. Everything else can go in the trash, as I am showing you in this video. And this concludes our video on ABG puncture. I hope you learned something today. Thank you for watching.